Thank you very much, President Warren. Thanks to all of you for joining us this morning. I'm very pleased to be back here at Lincoln Land and of course among students and faculty who are just doing a terrific job as we move forward and hopefully moving beyond the pandemic. I want to say what a great pleasure it is to be here, of course, with Mayor Langfelder, and very important members of the General Assembly have joined us, Senator Doris Turner, Representative Sue Scherer, and we're here really to talk about another way that Illinois can help our residents shape a good life for themselves and for their families. We have an incredible example to follow right here at Lincoln Land Community College. Lincoln Land is a leading hub for our Illinois Workforce Equity Initiative, which since its founding has enrolled over 5,000 students in high-demand training programs statewide. Here at Lincoln Land, that includes programs in manufacturing, in electrical and automotive repair, transportation and logistics, and the field that's saved lives throughout this pandemic, healthcare. In short, we're matching training opportunities in high-demand fields with Illinois residents ready to seize the next step in their careers, and doing so with a focus on communities that have historically been cut out of access and opportunity. It's exactly the kind of interchange that sets people up for success. When state government creates policies that really open doors for our residents, we ought to double down on those policies, especially as we shape our pandemic recovery. So I've proposed expanding on the impetus of WEI this year by creating the Illinois Pipeline for the Advancement of the Healthcare Workforce, the PATH program as we call it. PATH will invest $25 million in the community colleges across Illinois to remove barriers for recruitment and training of frontline healthcare workers. Participants will be able to get an industry-recognized credential or community college certificate in the shortest possible time, while enhancing their eligibility for employment as nurses, certified nursing assistants, respiratory therapists, emergency medical technicians, and other high-demand positions. And we'll do so with built-in wraparound support services for students, including, among other things, and you heard Dr. Warren talk about these things, covering the costs of transportation. They're burdensome on students, the cost of transportation, the cost of health care, the cost of food vouchers and tutoring. This is another way, by supporting these wraparound services, that we can make sure that these opportunities are reaching the people who are most in need. On top of that, I'm proposing that we add $2 million to the Nursing Education Scholarship Program and double funding for our nurse educator fellowships and competitive grants for nursing schools. Let's also eliminate licensing fees for 470,000 nurses and physicians, pharmacists and pharmacy technicians, respiratory care workers and social workers, and others in this coming fiscal year. That will save our healthcare workers around $21 million, and it's a way for all of us to say thank you for the amazing work that our healthcare heroes have done throughout this pandemic. Healthcare, manufacturing, business, transportation, no matter what profession they head toward, a great system of higher education has to be supported by and affordable for all of our state's residents. When I became governor, I set out to lower the cost of post-secondary education with a three-part plan for higher education. First, increase MAP scholarships by 50%. Second, make Illinois a top 5 state in getting more federal student assistance and Pell Grants for more students. And third, increase state support for institutions of higher learning, including great community colleges like this one, Lincoln Land. With the passage of my proposed new budget, we will not only have achieved all 3 objectives of my plan, but also expanded the use of MAP scholarships to cover the cost of short-term credentials and certificates like those offered right here at Lincoln Land. In doing so, we'll be able to support thousands more students as they seek the credentials that they need to excel in their careers and earn a better living. So we're finally making it more affordable for students across Illinois to get their degree right here in Illinois. And our future is brighter than ever before because of it. You don't have to take it from me. With us today are two students here at Lincoln Land, here to share how the new opportunities and funding are helping them launch their careers in healthcare, and what more we can do to support students like them. Luke and Lisa, thank you so much for taking the time to join us this morning, and we look forward to hearing from you shortly. Now I have the pleasure of introducing truly a great partner in the General Assembly, someone who is a leader and a fighter for the people of her district, and that's Senator Doris Turner. Senator?
Good morning. Good morning. Having watched Lincoln Land from its inception, I am always in awe of the great things that happen here. Every time I walk on this campus, I'm reminded of all the lives that Lincoln Land Community College and all the community colleges throughout Illinois have changed. Whether it's a recent high school graduate, a displaced worker, a non-traditional student looking for a lifestyle change, or a senior wanting to learn the newest craze, lives are changed, families are changed through our community colleges. And so today we have a governor who understands the needs of those communities that we represent and the barriers to addressing those needs. And he has used this budget to break down and break through those barriers. Increasing MAP funding and expanding eligibility to short-term certificate programs will move individuals from their dream of a new life and lifestyle to reality, making difference in their lives, their communities, and most importantly, often a generational change that will live on for generations. I'm especially excited about the investment in the pipeline for the advancement of the healthcare workforce program. As the former chief of the Center for Minority Health Services at the Illinois Department of Public Health, I understand all too well the barriers to access to health care. Often that barrier is the lack of a trained, diverse workforce. The PATH program, with this $25 million investment, will remove that barrier and lead to frontline workers who look like and understand the communities that they are serving, and that's what access to health care really means. I am proud to champion this investment in human capital and our communities, and will work with Governor Pritzker and my colleagues in the Illinois State Senate to see these initiatives become law. It's the right thing to do for the good health of all of Illinois. And I invite Representative Souchier to the podium.
Well, thank you everyone for being here. We really appreciate the media that's here to help us get this message out to the public. I am especially thankful to the governor for offering this up in his budget. I myself am a MAP recipient, and I'm sure that there are other people in this room who are also MAP recipients, and you understand that if it weren't for that MAP grant, you wouldn't have gone to college because there was no money at home to be able to afford things like that. And you might have been smart enough to get in college, but you didn't have all the little boxes to check to get the free scholarships. So I'm especially happy to hear of a 50% increase in the MAP grants. I've been here long enough that I saw a time when our former governor just slashed MAP grants and funding to public universities. And I'm not kidding. When I first heard this, I thought somebody was just kind of joking. I thought that can't be serious. No one could really actually think anything good could come out of that. And so it is, although 50% might seem big, we're trying to get back up to where we were and where we need to be, which is helping people in need being able to go into these service jobs. I was just talking in the back room and to a lot of people the last few days, and this is really laying heavy on my heart. I see the world from a different lens than most people see it from, and I have the guts to step up and try to change it. And that is service jobs. We are lacking in healthcare, in police, in teachers, in DCFS, bus drivers. Just think about it. Where are all the problems? They're all service jobs. So it's our job and your job to convince the everyday person that we have to start respecting these people. We have to pay them what they need. We need to encourage them to do their job. Another thing that wasn't mentioned today, but in the governor's budget, is to pay the pensions for these people in these service industries. And that's what this is all about. So let's all work together to try to convince society to stop hating on the people who take care of you and your children, your sick children, your children in school. You know, if something happens to you, you want to be able to call 911. We have to support all of these different areas. My own sister-in-law is an RN, and I think of the number of lives that she saved. And she started out in the junior college, you know, Richland Community College, doing exactly what these students, following that same pathway. And had it not been for this way to get in the beginning, how many lives could have been lost? So I applaud everyone here today, and I'm begging you that we all have the courage to step up and say, this criticism, this negativity about service people has got to stop. We have to appreciate people for what they do for us. So now I would like to introduce Luke Ridge. He is a student here in the nursing program, and I'm very anxious to hear his story. Thanks for being here.
Good morning. I'm Luke Ridge, and I am in my second semester of the Associate's Degree Nursing program here at Lincoln Land Community College. I think it's very important for anyone looking for a fulfilling career to consider the field of nursing to be part of the solution. There is a shortage of nurses, and we are needed now more than ever. I'm inspired to go in the field of nursing by observing the care my father received from the ICU from the compassionate nurses. I'm also a two-time cancer survivor, and the care that I received inspired me to help others in the same way. I currently work in the Springfield Memorial Hospital as an equipment and material specialist while attending nursing school. After I graduate and become a registered nurse, I would like to work in the ICU and continue my education, earning a Bachelor's of Science in Nursing and eventually a Master's. And now I'd like to introduce another student in the Associate's Degree in Nursing program, Lisa Robison Carter.
Hello, I'm Lisa Robison Carter, and I'm in my first semester of the Lincoln Land Community College Associate's Nursing Degree program. My husband is disabled, and I've been the breadwinner of my family. While working to support my family, I was not able to have the time or the means to pursue my dreams of becoming a nurse. When the company I was working for closed down a few years ago, I had to start anew. I found out even someone my age was able to get help attending college through the MAP grants. I completed the FAFSA application. I was rewarded with a MAP grant to Lincoln Land Community College. I took my prerequisites, earned my CNA certification, and was then accepted into the nursing program to become a registered nurse. I currently work at HSHS St. John's Hospital as a CNA while attending school. My professors are amazing. My family is very supportive. Without the very support, that's not going to happen. I have 3 adult children at home, one of which is actually attending as a student here at Lincoln Land for a different degree, but still within the service field. And she is also able to be a beneficiary of the MAP program when we could not afford to do that without. MAP grants have definitely made it possible for me to attend school and to prepare for a career in nursing. I am very grateful for the MAP program because it helps to make dreams like mine become a reality. And that's just a fact, period. And now I'd like to introduce Lieutenant Governor Stratton.
Thank you. Good morning, everyone. I'm Lieutenant Governor Juliana Stratton, and I use she, her pronouns. Thank you, Lisa, for that warm introduction and for sharing your powerful story. I'd also like to thank Governor Pritzker for his unwavering commitment to equitable, accessible, and affordable education in Illinois. and it's great to be here with Senator Turner, Representative Scher, and Mayor Langfelder. And thank you to Lincoln Land Community College faculty and staff for your dedicated service under the phenomenal leadership of President Dr. Charlotte Warren. Because of your work, because of your care, students are reaching their full potential. Students like the ones we just heard from, students who hold so much wisdom and deserve to be listened to and supported. Thank you to Luke and Lisa for being here today to advocate for yourselves and your communities. Your stories show just how vital this funding is. When so many students, who are often Black and brown, are locked out of pursuing their education because of financial barriers, investing in their futures is a matter of equity. While visiting one of our state colleges, a student told me, if my car breaks down, I'll have to drop out of my program. Another student said, I took a semester off to work because I didn't have $500 for books. Think about that. Think about the potential lost, the dreams deferred. We must do more to support our students, and we are. That's why Governor Pritzker's proposed fiscal year 23 budget puts resources in place that further prioritize education here in Illinois. MAP grants open opportunities that can change the trajectory of a student's life, their family's lives, and their community. With the support and assistance they need, students from our most marginalized communities can excel and go on to make a positive difference. On top of historic funding levels for MAP grants, the $25 million pipeline for the advancement of the healthcare workforce program will set students up for success. While this directly addresses the increased demand in essential medical personnel due to the pandemic, the PATH program's impact will extend far beyond that. I know firsthand the critical role healthcare workers play in communities, especially when they look like and understand the experiences of the patients they are treating. My father worked at community hospitals alongside nurses, therapists, and others that will benefit from this program, touching the lives of people from historically under-resourced communities whose needs often go unheard. We are on a mission to make Illinois the best state to obtain an education, and we are far from done. We know students and educators hold the wisdom to get us there, and we are listening and learning from them. As we visit campuses like this one all across the state, know that we see you and we hear you, and we will continue investing in you. Thank you, and I will now pass it back to Governor Pritzker to answer questions. Governor?
Thank you. Thanks. Before I take questions, I just briefly want to address the decision that was made in the JCAR committee yesterday and broadly about masks in schools. I think the most important point I want to make is that we have to do everything that we can to keep students and teachers safe while keeping our schools open. That has been my focus since the very beginning of this pandemic. Doctors say that masks are the best way to preserve in-person learning and keep children and staff safe. And as I've said, the ruling by the Sangamon County judge created an enormous amount of confusion, which is why we've asked the appellate court to move quickly to respond. The executive order requiring masks is still in place. School districts that aren't part of the lawsuit should follow the executive order. Everyone should feel comfortable wearing their masks to keep yourselves and your loved ones safe. As for the JCAR action, we refiled the rule as a procedural step to simply keep the status quo in place while the appellate court considers our appeal. The JCAR members preferred a different procedural route to suspend the rule while waiting for an appellate court ruling. I think we share the common view that we need to get a ruling. And either way, the next step is to hear from the appellate court and go from there. And so with that, I'm happy to take any questions. Peter.
Governor, the fourth district issued an order late yesterday directing the attorney to how JCAR's decision affects the case, seemingly hinting that it may have just mooted the entire case.
Well, I think that's what the filings are about. I think they're due, shortly today, and the appellate court will obviously have that either affect their decisions or not. But I know that the Attorney General's office is filing their brief on that matter around 1 o'clock today.
Governor, school districts have gone mask optional since the Sangamon County court decision, and JCAR says the rule's not in effect. You're saying that it is?
Yeah, the executive order is in effect. We still have a mask requirement in the state of Illinois for schools, and then more broadly, as you know, I've already announced that that outside of schools, that we'll be removing the mask mandate on February 28th. I'm looking forward to that. I know we all are, and then and then we'll see. We're going to hear from the appellate court, I would hope, relatively shortly, and have a little more clarity, despite the Sangamon County judge's ruling.
Branches of government saying that it's not in effect, that the emergency rule.
That's not what JCAR rule. In fact, what the JCAR members, and I think you heard from many of them yesterday, at least the Democrats who spoke yesterday, spoke about, as I believe, that we need to hear from the appellate court, and that is, in fact, we're figuring out, and they decided to move one way. We're figuring out what to do in the interim, and hoping that we're going to hear from that court very shortly.
The Majority Leader of the Senate, though, Senator Cunningham, a Democrat, said that at this stage, that using this executive power would be an overreach. That was his word. The question really is, at this stage in the pandemic, with so much that we all know about the risks, why don't you trust parents and local school districts to make those decisions for themselves?
You're, I think, misreading what he said and misinterpreting. The fact is that I trust parents, and what parents and doctors are saying is they want kids and teachers and the community safe. That's what I've been following all along. In fact, listening to the majority of parents, I think you know that a majority of parents in the state of Illinois and across the country believe that we need to keep a mask requirement in schools until it becomes safer. We're still watching our hospitalizations take a dive, which is terrific. And we're not yet at a point where we ought to be removing that mask requirement.
Governor, we're at 2.9% right now for positivity rate, and of course the hospitalization numbers keep going down, number of cases are going down. But a lot of these schools are saying, let's go mask optional as free for all right now. Are you worried at all that there'll be a rise in cases of youth getting COVID and teachers as well? And that could bring us back to where we don't want to be?
Look, I think that people of goodwill are trying to make good decisions for their community, for the people who are in schools every day, whether they're superintendents making those decisions or school board members or teachers and parents who are at the school, every day often. And so, there's, in my view, that from the very beginning, I've been focused on trying to keep people healthy and safe in schools and outside of schools. Schools have been an unusual environment, as you know, where 5 days a week, 6 to 8 hours a day, people are interacting in the hallways, running into each other. They're in rooms together, sometimes piled into rooms together, while we've had a global pandemic that has caused a lot of sickness and death. I'd want to remind you all that we still have about 1,500 people with COVID in the hospital today. That's not near where we were when we removed masks last summer. One of the reasons that we set a date for removal of masks more broadly in indoor spaces on February 28th is we wanted to continue to see the decline of hospitalizations in our state. And we hope, just watching them, there are 150 fewer today, I think, than yesterday, 200 plus the day before fewer. So this is all good directionally, and I'm pleased. But again, we have to be careful. The pandemic's not over. This disease is still out there. We're just all learning, I think, over the course of the last 2 years to make sure that we're managing properly so that if another variant were to come, that we're not so quick to have everybody removing their masks and you saw this, Delta was taking a dive. I think we were all very optimistic, and then you can look at the graphs of it, right? You saw it coming down, and then you saw Omicron taking us up again, and these are all very big concerns. So waiting, watching, and very hopeful for February 28th.
Our colleague Craig Wall wants to know if you can respond to Ken Griffin's $20 million check to Richard Urban's campaign for governor, and could you also respond to Richard Urban's insinuation. I think that there was some link between your signing of the Safety Act and the increased firearm attacks on police officers.
Look, all I can say about what's going on the Republican side is it continues to be a mess. There are an awful lot of views over there that people have had that are, causing more sickness. They're the ones who didn't want masks in the first place in schools, who didn't want any mitigations and thought that would be okay. We saw what happened in other states where they were eschewing those mitigations. So that's all the comment I have about that. All I can say about some individual candidates' views is they're wrong. We're trying to make our state safer for people across the state. Whatever the insinuation is about that, I can tell you that funding police training, making sure that we have police cameras, body cameras, which police want and the public wants. These are all a part of what we've been doing to keep people safe. Some of that is a part of the Safety Act as well. And so, I'm pleased that many of those provisions in the Safety Act that I just mentioned are already in effect, and some of the provisions that people are falsely pointing to and saying are making the world less safe haven't even gone into effect.
Can you
respond to critics, Governor?
Another
Can you respond to
emergency
critics?
rule here soon. Are you going to encourage them to include the due process rights for parents and also the staff or teachers that may want that included if they want to opt out not wearing a mask or the testing?
I'm sorry, in an executive order that I'm issuing?
In the emergency rules that IDPH will bring forward again, I'm assuming that they're going to want to do another emergency rule.
They haven't come forward. I have not heard what IDPH is going to be doing going forward. So
It was requested by members yesterday from J-Card. That's included in the next rule, though.
yeah, that's something that I haven't considered it.
Why shouldn't there be due process in this?
If your order remains in effect, why even file a new rule?
Well, again, the order is in effect. We're now trying to deal with an errant decision by a judge in one county, one particular judge. It's thrown everybody into a state of confusion, and we're trying to get the appellate court to address it because it was wrongly decided.
Governor, this is about due process, the issue of due process. You're innocent until proven guilty. People believe that you're healthy until proven sick.
Yeah.
As it is with your order, it takes that away. Everybody's assumed sick. They got to wear masks. They got to be excluded, even though they may not test positive if they're a close contact.
Again, the judge's decision, which you're referring to, poorly decided. It leaves out entirely a section of the law that she obviously either didn't read or didn't want to address. So I think that's all going to be considered by the appellate court. Jeremy, yes.
There's obviously been a rise in violence that we've seen in the last few years, and whether the Republicans are right or wrong on their views on crime, they're really hammering the Democrats hard on the crime issue. Does that worry you going into this?
No, they're wrong. Let's be clear. The Republicans are wrong. They're the ones who voted against funding state police. They're the ones who voted against funding cameras. They're the ones who voted against the very investments that we need to make in communities in order to reduce the amount of violence and crime. And then they, it's like the arsonist, right, lighting the house on fire and then, calling the fire department saying, I don't know what happened. That's what the Republicans are doing. They're wrong on every point.
But are you worried that their messaging could be affected? Whether they are right or wrong?
They're going to put out false messaging about this, and I would hope that people will see through it. I'm certainly going to help them see the truth.
Can you respond to the criticism of your pardon of